Hi, I am Dr. Alka Kalra. I'm a licensed educational psychologist practicing in Dubai. VB MAPP, what it is and how to run it, how to read it. So let me tell you that VB MAPP is an acronym which actually means verbal behavior milestones assessment and placement program. So it's something which is useful, and I think it is important to understand this clearly. So VBMAP is an acronym that stands for Verbal Behavior Milestone Assessment and Placement Program. What it is: protocol and guidebook. It is written by Mark Sundberg, who's also a BCBA, and it comes in two parts. There are protocol and a guidebook. And between the two parts, the VB map includes a milestone assessment, a barriers assessment, and a transition assessment. Task analysis and skill tracking, VBMAC placement, and IEP goals. Sort of suggestion where to go next. So it includes those five parts. So I've been lucky enough to see the trainer understand it a couple of years ago, and now it was done by him as a two full 8 hours training. But now we are going to avoid that and do it in a shorter time. And briefly, we are going to cover the milestone assessments and the various assessments, and that will kind of get you off the ground and running and hopefully be enough to help you at least in the beginning. So, who is it for? It's written for learners whose language skills have not yet surpassed that of their age, typically developing 4-year-old, regardless of their chronological age. So that could be a 7-year-old child having language development skills, but not up to the age specific. A learner who is a preschool age, a learner whose language skills are considered at risk. So the child who has no words by the age of 2. So this is we are talking about, and any child who has no words by the age of 2, I'm sure needs assessment to cover all those types of learners. So the first part where is going to look at is the milestone assessment. And this piece of assessment really looks into what does the learner know, what skills do they have, and this is a great baseline assessment. So maybe you've got a new client or you've just got into a new job. For the first time, the new students, the new learners, it would be a great assessment to go ahead and run it through with them and see that what skills the learners already have in their communication. So if you open up to protocol book, one of the first pages you will see is called the master scoring form, or you also hear it called scoring assessment grid. Things like that, and you will notice that it's divided into multiple levels. Down in the bottom in red, then is green, then is blue, and the topic is use some of them. Put your child's name, the date of birth, and the testing date, and then you start. The dates of the tests are very important coordinates, and a color out there is very, very significant. So it actually helps you to track how often you run this assessment, and the assessment is designed to be run 4 different times of the same learner, so that why there is a different color, we will get into it in a bit later. We break down each of those 3 levels. You will see that one, which is that of red level, on the bottom is indicated as a milestone that learners 0 to 18 months should be hitting. Level 2, which is green level, that is for learners 18 to 30 months should be hitting. these milestones. And finally, the level 3, that's a blue level, the learners from 30 to 48 months should be hitting those milestones. The VB map is a criterion reference assessment, meaning that an individual's results are compared to a preset standard, and so that's the kind of how all this is devised. So let's look at this red level. If we look a little bit deeper into it, one level, you will notice that it's divided into 9 different repertoires. Again, this level is the milestones are aligned and the learners who are 0 to 18 months of age. So those 9 repertoires are along the top. There you see that each one of these are a little bit in detail. So the first is demand, so that just your request. Does the child ask for things? How many things do they ask for? And how often do they ask for them? The second repertoire is the tact, so that the label, does the child know the name of the things? Can he or she label things? Or the third is the listeners. Can he follow directions? Can he or she select items or pictures when asked to do so? The third is abbreviated as VPMTS, stands for visual percept or match the sample skills. So these skills look at and can the child attend to books, and she is able to match their skills as a visual learner. Play is next, can be child demonstrate early play skills by exploring objects, their own motor behavior. Are they curious by the toys and running? Are they playing? The next one is the social. Does the child notice the other people? Do they attend to other people? Do they typically watch them? Do they attempt to interact with them? Kind of on the social aspect. Next is limitation. So, is the child able to copy the behavior of others? Echoic deals with, can the child repeat the specific word or the phrases? Can they are said by an adult or a peer? And lastly, vocal looks at, does the child experiment with his or her voice? Do they make the noises and the noises different? Are they repetitive? Do they babble if they are kind of begun to recognize that their voices can get them what they look like? So look at a little bit further into each of, they're going to go the little bit deeper into it. For today I'm going to take each one because that would take us a long time into a man a bit deeper. So let's understand the background about the each one of these. So that the man repeater, as you saw on the last slide, and I'll flip back the real quick, is divided into 5 sections, actually 10 mini sections. So each section has 2 parts. So here's 1, 2, 3, 4, and 5. And each of those deals with 5 of the milestones related to that man in level 1. Let's see this. So we look a little bit closer to continue to flip through your protocol book, and you get to level 1 man. So this milestone, so it begins separated 5, the main things that this repertoire is looking at. It says a child use the words, signs or pictures, or to ask for the desired items or activities. The very first part of this kind of what Sundberg sees is the first milestone, and getting towards this goal is that the child emits 2 word signs or pegs, but they may require a quick imitation or the other prompts, but no physical prompts. So maybe mom has to hold up the cracker and say, do you want that? and the child will say cracker, or maybe the dad has to hold up a book and present the American Sign Language sign for book, and the child will imitate that sign to ask for the book. So things like that, and it goes on from there. So it increases in number, emits four different mans, generalizes six mans spontaneously, limits five mans, and its 10 different mans goes up a number and then goes up in complexity. So are they asking for things without any prompts? Are they generalizing their minds? Can I ask for two different books? Can they ask both mom and dad? And can they ask, in Target, that also in their bedroom at night? And then they are doing that spontaneously. In number four, so are they just coming up to mom and dad and saying that they want the cracker, or does that situation have to be contrived? And then finally, the number five looks at whether they are being able to ask for 10 different items. So, again, increasing the number with no problem, except for maybe what do you want? When we look at the scoring, the milestones, there are four sections. Varies milestone. Are we talking about there enough space to run the assessment four separate times for the same learner? So again, you usually do the assessment 1 year apart, but you might do it when you come into a new business, when you meet a new students, new learners, new clients. You might do it if you're needing to write new goals. It might be a good time to run the assessment. The IEP is coming up, or you're creating a new treatment plan, things like that are all good items to return the assessment so you can see progress and a kind of this idea of where your learner is. And the score for each of these milestones are either a zero, a half, a point, or a 1, and they are added together and recorded in the total score box. Each milestone can be scored as followed. 1 point indicates that the child can complete the skill as it is written there. There are no exceptions. They can absolutely do it every single time. As half a point can be scored for a child who is able to complete some portion of the skill, but they are not yet mastered the entire skills. And this is the way where your guidebook really comes in handy. While a half point is sometimes allocated for being to do half the required number, and that's not always the case. So you will really need to go back and reference your guidebook to see when you're allowed to give a half of a point. And then the course you can give a zero. So that kind of says I've assessed the skills. The learner is not always to do it independently at the level that's described, or that a requirement for half of the point, and so this go gets a zero. For an example, one of our milestones within the man repertoire is that the student will spontaneously man 5 times during 1 hour observation, they get a point. If they man 5 times during 1 hour observation, they get half a point if they manned 2 times during a 1 hour observation, and that would be 0 points if they manned 1 time or lesser, or if they manned 2 times but they require physical prompts. So again, I had to reference the guidebook because half of 5 obviously is 2.5, and the requirement is just 2, and so sometimes it's not always right at the half a mark. So to go back a little bit to within our protocol to the assessment piece, and we are thinking to have a scoring guidelines in our mind, and we are looking back at this. Within that first box, these are where we are going to run that first assessment. The very first one gets the score of a 0, a half a point, or a 1. The compilation of all four, 5 of these, excuse me, that all gets put up into this total score box right here. For that first running of the assessment, and then you can record the score for each of the 4 assessments. Here, another important note is that at the end of each milestone, we will be in assessment code, and so that kind of tells you how you need to assess for that particular skill, and we will talk about that next. And another very important spot here is the spot here for comments or questions, notes, things like that. I particularly like to write in if my learner, what my learner might have asked for, or which picture they could identify, so that when I'm running this again in a year, I can say, oh, they already have, they were already able to ask for crackers and the book last year, so those won't count as additional mans. They can still obviously continue to count as their 2 man. So, thinking about those assessment codes, the codes are as follows, and this is explained very well in a protocol book. T means that you need to directly test the skill. So you must obtain these data by directly testing this milestone. In O means that you can observe the skill occurring, so you must obtain this data by observing, but not interfering with the learner. So maybe if you're looking at, for instance, labeling them, and you know you're looking at, does the learner spontaneously label 3 things in the environment, and you have to do that by observing. So you can't go in and say that, is this, you just have to say whether you know whether they are saying or an aeroplane, or you know there is a car, that mama's car, things like that, those would be tags that they are emitting without you needing to interfere with that. So would be data that you would obtain through observation. The either means that you can test it or you can observe it. Personally, I like to do a little observation and see if I can see it spontaneously without interfering. But if you need be, you can jump in and directly test that milestone and then to stands for timed observation. So you must obtain these data by completing a timed observation of your learner, and generally that will correlate with some sort of a goal. So spontaneously mans for 10 different items, and that must be tested or assessed via timed observation for 60 minutes. So within 60 minutes, the learner has to ask for 10 items. If they don't, they do not meet that aim. So that has to be completed within a certain amount of time. So, for example, to look back again at our man repertoire, I assess this with my learner. They were able to emit to signs, words, or packs. They may require imitative, echoic, or other prompts, but no physical prompts. So I gave them a full point. They were able to do that skill, and then they were able to man for two additional items. So now they've hit the four. So I gave them a point for that. I then saw the man for two additional items. They were able to generalize all six of those items across two people, two different settings, two different examples of that item. So I was able to give them a point for that. And then I did a timed observation. I observed my students for 60 minutes and I noted that they were able to spontaneously ask for five different things. Some of the items present, not all of them, but they hit that five mark in a timed observation. So I didn't come in and ask them what they wanted. They just spontaneously asked for five different things, so I gave them a point. Number five, however, they were not able to get above six. So while they were able to generalize six different mans, they could not hit the 10 mark. And so I gave them 0 points for that. They didn't reach half a point mark. They acquired some different prompts, things like that. They got a 0 for that. So I went ahead and noted that 1, 2, 3, 4 and 0 is a total of 4, which I am noting in my assessment box up here. I also made sure to make a note about a number 4, in particular that in July of 2016. Susie is able to request for her cat Binky a toy car crackers, a juice box, and her pink tutus spontaneously. But those were the things that she requested without having to be shown the items or asked what she wanted. I then take those notes that I made, so my scoring in that first column, and I transfer that onto the assessment grid. So, where I indicated a 1 that the student was able to complete the skill and then find a number 1, and I color that entire box. The dotted line indicates that half point marks, and we will talk a little bit about that. But right now, the student got a one colored in the entire box. So in milestone number 2, they also scored a one color the entire box. 3 and 4 followed suit with scores of 1, so the entire box is colored. They got a 0 for benchmark number 5 or milestone number 5, and so I did not color in any piece of that box. And that's how that first manned column for that repertoire will look in level 1 on my scoring grid. Some other common possibilities for scoring is that the student scored uh, got a 1 on milestone number 5, so I colored it all the way in milestone number 4. However, they only were able to do half of that milestone. They were only able to complete that one, so I then half, and that's what your half point will look like. Same for number 3, they were only able to do half, so I colored them below the dotted line number 2. They were able to complete the full milestone, the full scale, and the same with number 1. Another potential option for scoring is that I assessed every milestone within the man repertoire for level 1, and my learner was just not at that level. So if we think back to the first milestone, is that they were able to emit two mans, maybe requiring some prompts, but there are pecs or their vocal or their sign, maybe. This learner isn't really asking for anything, or the only way that they are able to ask if by looking at something, you know, they I know that they want something because they just sort of look at it, but they are not using their words to ask, they are not signing to ask, and they are not exchanging a picture to ask. So I'm going to color in that first little dot down at the bottom, indicating that I assess this repertoire, and the learner was not able to score a 1 or a half a point on any of the 5 benchmarks or milestones. Another one of the repertoires within level 1, and it continues in through level 2 and level 3, is the echoic pack, and this is a specific test that you're gonna need to flip through your protocol to find. But the way that the scoring grid works and the way that the milestone works for the echoic repertoire is that it goes through and says the student scored a 15 on the echoic subtest, the student scored a 20 on this co-accept test, so 25, etc. And so you will need to run the clip test to get your score in order to be able to score that within the repertoires along sort of those milestones. So, for this particular piece of the assessment, you're going to begin at group number 1, which is up here, and you continue running group two groups, three groups, four, and group 5, unlike some other assessments. If students are unable to do a few in a row, you don't stop. So I like to try and complete the entire assessment. Certainly not in one sitting, but I do like to finish it in, because a lot of times what happens is, while a learner may witness some words in that group, one they might be already familiar with, some words or some phrases in the group 3, and so they're able to do those, and I want to be giving the credit for that. So the way that this works is it lists out words. This first one is the teacher would say ah, and the student would echo, and it, if they are able to echo it entirely, so meaning that you could understand each piece of it, and we will get into scoring a little bit later. You're going to score it accordingly. You score again the entire assessment. Don't stop. Students can surprise us, and then you will total your score in each group and record here. And the total of each group in the entire assessment will be recorded at the top. It's also important to note that while a lot of our students are very successful using a different type of voice output devices, this assessment does need to be vocal in order to receive a score. So we are looking at scoring this. We are going to mark an X. I mean, that means that the correct sounds and the correct number of syllables were emitted by the student, and so the student echoed the word or the phrase exactly how I echoed it. That sort of equals 1 point, but we are going to mark it as an X, and I will tell you why next. So if a student is able to produce a recognizable response, but it's maybe incorrect, or it's missing consonant, or it has an extra syllable, you're going to score that as a slash, and that's equal to half a point. Differentiating that slash and the cross is helpful, because the following year, there's only obviously one form for this assessment. So the following year, you go into races and you're going to just go back through all your slashes. If the student is able to echo the word or the phrase completely, go ahead and add another slash and make that an X, and if not, they can leave it a kind of as is. So it's important for this piece of the assessment to kind of stick with that X. It just makes it easier down the road. You add up and total number of X's and slashes, and you record the subtotal for the group box, and then you record the totals in the subtotal groups in an appropriate box at the top of the page. So when I ran this assessment, the student was able to receive full points on the first three of these echoics. I believe those words are wow and B. They had a little bit more trouble with knee and a little trouble with ooh. And so I was able to give them a slash mark for those I added up and the totals there and came up with 19 and recorded that in the subtotal for the group 1. That in subtotal for group 1, that sort of rounds out your partner, sorry, your part 1, that sorts of level 1 in the milestone assessment. And while we won't go through the level 2 and level 3 in as much detail as I want to cover that, level 2 and level 3 add additional repertoire. So in 2 you will see 4 additional repertoires, including LRFFC, that is listening, responding by function, feature, and class. So looks like can students select an item based on what if does the function, the one that drives, the one that flies something about it, a feature, so the one that has wheels, the one that has wings, or its category, the vehicle, the animal, things like that. And the next repertoire that is added in level 2 is the 4, which stands for intraverbal. Does the student verbally respond to the content of words of others, or do they engage in conversation? Do they answer questions? The third edition is a group assessment, and these milestones look at, does the child follow daily classroom and group routine and expectations? Are they able to do the things that are expected of them in a classroom or in a group setting? The fourth that's added is a category for linguistics. Is the child's articulation clear? Is his or her vocabulary growing? Our words becoming phrases and sentences? Is all of that sort of happening appropriately? And we get into level 3, an additional 3 repertoires are added to look at reading. There's a child's interest in words and books. Can they label letters, read and comprehend words? Writing, which looks like, does the child draw, copy letters and numbers independently, write his or her name and then math? So does the child know numbers and quantities? Can they count? Can they measure again? Keep in mind that this assessment is only for learners up to 4 years of age. So you know what can a 48 months old be expected to do so. Keep that in mind when we are thinking about reading and writing and maths and things like so some helpful tips for running the milestones portion of this assessment is that you want to keep that guidebook close to you at all times. Your reference it You reference it frequently until you become fluent with the material and the scoring system. And even after 4 or 5 years of running this assessment, I still need to use the reference it all half point scores, etc., because I'm still not entirely positive. You want to make sure that you gather your materials and that you read through the test and your test items prior to running the assessment. So, your materials include both physical items as well as maybe lists of tasks you may need. So when you get up to some of the higher levels, some of the more in depth milestones, it's nearly impossible to come up with something like 30 verbal directions right on the spot. So you want to go ahead and have your list so that you can go ahead and reference it, and you're not trying to come up with these things as you're trying to assess. The students keep their attention score, the assessment that can definitely get overwhelming. I would recommend only running a few milestones or repeaters at a time. You will get exhausted, and so will your learner, and that's going to definitely impact their performance. So, I like to kind of jump in that time of the day when they would be used to working on these things anyways, and a kind of assess in those moments. And the assessment does take you, no, in the beginning it definitely takes over several days, and as you get better about it and you learn a bit more about it and become more fluent, certainly it is a little bit shorter, but you still definitely need to keep in mind what your learner can handle. You want to use a pencil your first few times scoring the assessment. This just makes correcting mistakes a little bit easier, perhaps. You give half a point and then you go back and look at the guidebook and you realize that half point isn't available for that particular milestone. So you can easily sort of erase and add your zero there. I definitely recommend making notes. In the notes, that comment section, it gives you a little bit more comprehensive present level of performance. So, if a student is able to do something, for example, to tag, to label picture, to take pictures. It's so helpful to know which pictures they were able to label, because maybe patterns start emerging. They're really great with labeling animals, but I noticed that, I give them credit for all 25 of their labels, and they were all animals. That's what they could label. So maybe a kind of thing start to come out at you, that maybe certain repetitors do need a little bit more work, and you see that in your notes. I always say, never underestimate your learner. Test it out. And if you test out all of level 1 milestones, so the owner takes 10 items and he is not able to complete the task in a penalty, then it's okay not to test level 3 of the same repertoire. So if they can't attack 10 items, they're probably not going to be able to attack 30 items, and that's pretty fair. But other things, I would definitely say test that. Learners have surprised me so much, especially within the intraverbal repertoire and some of the higher level 3 replies, the math and the writing things, like that. They will surprise you. So I would definitely say to test it out. So the finished product, I've run all of the different milestones. I have looked at everything. And I have I filled in my grid with the correlating scores, and this is sort of maybe what my finished product might look like. So notice at the top, I have a student's name in, and I have their date of birth. I then input the current dates of July 2016 and my initials. So I've colored everything yellow as that was the corresponding color, and then it's calculated a score for me. And that's sorts of what your assessment will look like. And we will get in a little bit later into looking at interpreting this assessment, this but might be what your scoring form looks like. This is fairly typical for early learners with an autism spectrum disorder. This sort of curve in the grid here is pretty typical. Part 2. So the second part we are going to talk about is the barriers assessment. And while the milestones assessment looked at what your learner is able to do, the barriers assessments help you assess 24 common learning and language acquisition barriers that are faced by children with autism or other developmental disabilities. And it also, by identifying these barriers, the clinician can develop specific intervention strategies to help overcome these problems, which can lead to more effective learning. And so, those were sort of quotes by Mark Sundberg that he felt like really summed up with this barriers assessment is really for. So we are looking at scoring the barriers assessment. Each one presents a different issue that might be faced, or a barrier that might be faced by the learner. So, as you can see, this first one is negative behaviors. Scoring occurs on a 1, 0 to 4 scale, 0 indicating that this is not an issue for the student, and 4 indicating that this presents a severe barrier to the student's learning. So, you will read each statement under your barrier 0 through 4. Well, that scoring system is fairly typical. Sometimes the barriers will get in a little bit deeper. So maybe it will kind of explain a little bit more what one would indicate for this particular barrier. So it's important to repeat all the way through and to find the sentence that best describe your students' negative behaviors or barriers. So, some examples of some of these sentences are things like Emmett's non compliant behavior several times a day with longer tantrums and more severe behaviors. So maybe I'm reading this, I say that's not really this learner. Let's bump down and try number 2. So, number two is admits non compliant behavior a few times a day with minor tantrums or other minor behavior. And again, I think, I don't know, it's not really a few times a day. Let me check out the number one. And the number one is some demands will evoke more non compliant behavior, but the recovery is quick. And I think that's definitely my learner. You know, while he will do a lot of tasks presented to him, he really hates maths. And so sometimes he will engage in some non compliance during doing the maths tasks. But he tends to recover pretty quickly, especially if you can distract him. That makes sense. That sounds like my learner. So, you're going to add that corresponding number into the first box of the assessment. So for that, I decided one for instructional control, most described my learner, and the barriers that this presents to my learners learning. So I'm going to indicate that one score over here in my assessment box, barrier assessment. For the barrier assessment, you want to read each description before scoring. Again, while it's sort of a 0 to 4 score, it's important to read each one because each one goes a little bit deeper into what that barrier means. It's also a great time to learn a little bit more. For example, instructional control is a barrier, and maybe you weren't quite sure what instructional control meant. But if you read through each of these sentences, it kind of plays out for you what instructional control or lack thereof might looks like in different situations. And so it's definitely important to read each description of each number, and I also definitely want to shoot out the reminder to consider the assessment for each barrier and use your data. So it's very easy to say, you know, in terms of maybe stereotypical behavior, for example, which is one of the barriers. Well, a year ago, she was only flapping in the corner, and now she is definitely working a lot. She's so kind of only flaps under the table, so that fantastic. And while that is fantastic for that learner in particular, if we would still consider a child who's flapping under the table fairly frequently, we would still consider stereotypical behavior to be a barrier to her learning, and so kind of try to remember what this would look like for a child of the same chronological age when you think about whether this is a barrier to your learner. So the finished product of the barriers assessment might look something like this. This would indicate that this particular learner has sized significant barriers in the defective tact, so that was one scored that a 4 and then some defective intraverbal, that's a 4, and then some defective listener skills, some defective visual skills. So all of those things are kind of up there. Meanwhile, if we look up here at the echoic, the learner doesn't seems to experience a significant barrier to learning in the echoic. So that might indicate to me that wow, they are got some pretty solid echoic and some pretty solid imitation skills. Maybe I can use both of those things to help out sort of where I see more barriers. So the defective tact, defective intraverbal, things like that. Yeah. So, some tips for interpreting the results of this is especially the results of the milestones. You want to find the whole, so teach the deficit so that splinter skills do not develop. There's a particular hole somewhere, and there's another repertoire that's all the way up in level 2. We want to focus on that hole in level 1 so that we can fill that hole first. Sundberg recommended not continuing beyond the child's chronological age in any repertoire. So if you've got a 1-year old who's kind of sitting within that level, one, maybe he's, 13 months, 13 months old, or he's level 1. We don't want to be teaching level 3 or even level 2 skills to that child, and we want to teach the deficit and not sort of continue to add on to strengths, because that really just increases gaps in the learning. Do not advance one repertoire at the expense of the other. So perhaps your learner scored fairly low in the man repertoire, but their play skills were phenomenal. They scored all the way up into level 2, and play skills you don't want to keep teaching to level 2 and level 3 in play skills while that man continues to be underdeveloped. So, you want to really put time and resources and energy into developing that man and a kind of ultimately bringing that learner skill set all to the sort of an equal playing field. And we also want to think about always, and I mentioned this is a second ago, looking at those barriers in one repertoire strong enough to use that repertoire to teach another repertoire. And we will look at a little bit in that, especially. So, again, back to our master scoring form, our scoring grid. This is sort of the way that our learner assessment played out, and so a quick visual analysis of this would tell us a few things. First of all, I highlighted the holes here with the giant red circles, and that's where we need to teach. So again, we don't need to come up into level 2 of the visual perceptual skills, the play skills, social skills, imitation, teach skills. We don't want to into the level 2 of those until we really can make some progress down here and getting that man the attack, the listener, the echoic, and the vocal skills up into that same area. Quick visual analysis tells us the weakest repertoires for this learner are the man, the tact, the listener, the echoic, and the vocal. So, what I am also seeing when I go back to those milestones and see which milestones were missed, is there's not a lot of spontaneous sounds going on. We will need to probably condition sounds to have value because the learner just isn't using their voice a lot. So this, as we said earlier, this sort of plays across this visual grid. It is fairly typical for a learner with ASD. So a lot of times play skills will be up there, but man needs to be pretty low. A lot of this vocal behavior is going to be pretty low. The strongest repertoires for the students are visual perceptual play, social and imitation, and right off the bat, I would say that awesome that playing social are pretty good. That's a really good sign for this learner and for you being able to gain instructional control and to offer a social praise, hopefully, as a reinforcer. Later, the imitation skills are stronger than the echoic skills. So, when we are thinking about coming up with a communication system for this learner, they are able to imitate really well. Maybe we have a future American Sign Language communicator on our hands. It might be a little bit more difficult to evoke some acoustic behavior, but that imitation behavior is already really strong. So maybe we can jump right in and get increase. These means by teaching some signs via sort of that limitation pathway. Imitation is also stronger than listener skill. So maybe we could use some model prompts because the learner is able to imitate, they are able to follow a model prompt to teach some listener skills. So we kind of quick visual analysis tells us a few important things about this learner and about the kind of where we are going to head next. When we look a little bit closer, we're going to look specially demand the text and listener behavior. Mm. In man, the learner scored 0 0.5, in milestone 3. And so the piece that they missed, that they were not able to generalize, 6 means across two people, 2 seconds, and two examples of a reinforcer. So maybe they scored half a point, maybe they were only able to generalize 3 different mans. Number 4, they missed the entire chunk of number 4, the entire point, and that deals with spontaneously emitting 5 mans. The desired item can be present in a 60-minute timed observation. So, I'm not seeing really someone, any spontaneous manning behavior. And then number five is that they emit 10 different mads. Without prompts, the desired items can be so again we are probably looking at volume. Maybe the learner was able to imitate the 2 and the 4, or I'm sorry, they were able to man for 2 and 4 items, but they're not able to spontaneously do those things. They are not able to request the volume that number 5 requires. The tact, if looks like they struggle to spontaneously attack 2 different items, and they struggle to then spontaneously text 10 items. So again, just increasing, we need to look at increasing the number of items or pictures that they are able to label. And then the listener 4.5 requires them to perform 4 different motor actions on command. They scored a half a point, so it's likely that they were able to perform 2 motor actions on command. We just need to be able to increase that. And then number 5, they were not able to select the correct item from an array of 4 for 20 different objects or pictures, or when asked to touch dog, touch cat, they were not able to hit the aim of 20 for that. They also didn't receive half credit, which means that they were not able to hit whatever the guidebook indicates to us is the half point, which I would guess is probably 10 different objects or pictures. Note really quick to look for themes throughout. So the students appears to have challenge with spontaneous speech both in the man and the tact. So they missed the number 4 for the attacks because they were not spontaneously tacting different items, and they also missed number 4 for the man because they weren't spontaneously manning. So again, this is a kind of indicating that spontaneous vocal speech might be an issue here. And that kind of wraps it up for us. So, we kind of talked through the milestones assessment, we talked through the scoring grid, and how to interpret sort of some of the scores, how to move them to the scoring grid from the milestone assessment, and how to look at the big picture. And we also talked about the barriers and how to sort to delve into each of those and look at what makes the most sense for your learner in terms of scoring the barriers assessment. So look at what makes the most sense for your learner in terms of scoring the barriers assessment, and then a real quick sort of thought to what to teach next again. All right, so I think that is it, and this was the purpose of this teaching. I hope you all enjoyed learning this. Wish you all the best. And this is Dr. Alka Kalra signing off, and I wish you all a lot of luck. Please follow us on our YouTube channel, on our Insta page, as well as Facebook. Thank you.